Welcome to Chad the Home Care Guy. Real conversations about aging, home care, and the decisions families face every day. Hosted by Chad Fisher, founder of Avail Home Care. Because caring for the people you love shouldn't be confusing. Let's get started.
All right, guys. Hey, this is Chad the Home Care Guy, and I am back with another episode here today with a friend of mine, Holly Ray, over at Aviata. Am I saying it right?
Yep, Aviata.
Aviata. Okay. We're in one of their buildings today called Sand Key, but they have several buildings?
Yes, we have over 50
Over 50.
in the state of Florida.
Crazy. That's a lot.
Yes,
Well,
in a short amount of time.
I know. That's crazy. Start off by telling a little bit about yourself. This is what I do with everybody. I at least want them to know where you came from and a little bit about maybe how long you've been doing this and why you chose it.
Okay. So I have done healthcare. That has been the facet of my career. I started off when I was 16. I've been doing it for 25 years.
16? What'd you do at 16?
I was a CNA.
Really?
That
So you
was my
started off as a
first job.
CNA?
Well, I worked for the newspaper as my first job, but my first official job was a CNA. My aunt was the staffing coordinator. So she had this bright idea to put me through CNA school so that I could fill up her shifts on her schedule, fill those holes for her. So it made her look good. And then from there on, I did CNA work. I went and worked in activities in the activity department. I would pick up shifts in laundry, worked all the holidays. I transitioned into admission social services. So I would admit the patients in the morning, discharge the patients in the afternoon or vice versa, basically supporting the marketing director and the social services director in the building.
So you're
and kind of transitioned
ground
into
up
that.
at this point. You've done pretty much everything.
Yeah, I've kind of worked my way. I always seen the fancy lady in the admissions office, you know, she had all the nice jewelry and she was so sophisticated. And I'm like, I want to be her. So shout out to Cindy Goff because she's the one that kind of got me into that particular environment. And that's where I thrive.
All right. And you're from Ohio.
Yes. Go Bucks.
Yes. OH.
IO.
All right. And how long have you been here?
5 years.
5 years. What made you make the move? Was it weather? Was it job?
Yeah, it was a lot. The weather. Also wanted to get my kids before they entered into high school. I didn't want to have to switch their schools before that. Had planned to move a couple years prior and then kind of stalled it for a moment and then was like, no, we have to go.
What made you choose this area?
I went to a wedding in Clearwater and that was what drawn me to it. It was the only vacation that I wasn't ready to go home.
Really? No, that's cool. I mean, I hear that from most transplants that do come down here. It's like some one moment where they've come down here and seen something, you know, that it's life-changing for them. And then they come down and they spend the rest of their life here. So
absolutely.
It's not a bad place, right?
No,
it's
awesome. Absolutely not.
For families who may not be familiar with Aviata, what makes this place different from other senior living options in Tampa Bay?
I think the culture and the connection that, you know, starting with the CEO, the CFO, Ami, Nathan, and Aaron have worked really hard in a short amount of time to build the culture to where it is. And the number one thing is customer service. It's not a sprint. It is definitely a marathon. You know, coming out of COVID, we've had a lot of, I would say, newbies that came into healthcare and really needing that strong culture of customer service to really understand why they're here and what they're doing. You know, we're not running an assembly line. We're taking care of patients and patients deserve to be respected, especially seeing that, you know, they were teachers, they are moms, they're dads, they're you know, engineers, and they deserve to be treated with respect in, you know, those final years of their life.
Yeah. And then was it a slow roll or all 50 came at the same time, or how did they end up grabbing all of those facilities?
Yeah, they were all within a few months of each other.
Really? That's a big purchase.
Yeah, we started off as Aspire Health Group.
Okay.
And then we went through the name change. It's probably been about a year. So.
Okay. So a year, that's been the change. And are all of them changed at this point in time? So
yes. Yeah.
Through the motions. Okay. Talk to the families a little bit. And when is the right time for a family to start considering a move into an assisted living or skilled nursing place? And what signs do they look for?
I would say it starts off a lot of the times with caregiver stress. When you have, a husband and wife, for better or for worse, you want to take care of your loved one. Or if it's, a kid that is taking care of their mom or their dad and it's just getting to be too much,
Yeah.
I recommend, trying it out with respite so that it's kind of that short-term commitment, and it's kind of that try it before you buy it.
Yep.
Or if it's for rehab, if it's for a short stint in our rehab just to get stronger so that you get that independence, then you can transfer into back to your home.
Yeah. And you have obviously 50 facilities, and this one we're sitting in today, we're actually in the barbershop, the salon today, because this is the quietest place we can be at. I've already been asked to cut one resident's hair, so I probably should have. But what facility, or this particular facility, what does this one have inside of it? As a person that was looking around, does this have all of the things, or is this long term? Or
we have physical therapy, occupational therapy, and speech therapy. Predominantly, Sandkey serves the long-term care population, so a lot of our patients are going to stay here until they transition. We have Holly, our administrator, Holly Chuduk. She was one of our administrators of the year for the company.
Oh, awesome.
And again, like I said, with the culture of customer service, I think that she came into this building, saw the opportunity with her and the DON Al, and they are fantastic.
Yeah.
I mean, they have went above and beyond to extend out the trainings, doing the teachable, education so that the staff is able to take care of the residents and take care of them appropriately.
Yeah. Now, do you serve Medicare and Medicaid here?
Yes.
Okay.
Yeah.
What's that look like as far as the spread of what you have?
I would say we probably have about 70% that are Medicaid.
Okay.
And then the other 30% reserved for short-term and rehab, both Medicare and managed care. We take commercial policies. We also do complex cases with the hospital. So we'll do hospital contracts when need be, just to build those partnerships up with Baycare and CA.
Yep. I was actually at the hospital just a few days ago with someone that works here with you guys.
With Tatiana.
And we had a good time, a little breakfast, and got to talk to some of your team as well. And well received in the hospital, by the way. I don't even have to mention which one it is, but we walked in the door and you guys walked in with us, and they were all super thankful that you guys were there and knew every one of them. And it was kind of cool. So
I think
you're making an impact.
Yeah, it makes a difference when you're not just there for, our easier residents, I'll say.
Right.
Our higher paying residents.
Anybody can take those.
We are the provider of choice because we work with our partners.
Yep.
When
taking on the hard stuff.
Yes. When our case managers or the directors even will call me on my personal cell and say, hey, I have this case. I need your help. Our team is on it. Awesome. Within an hour, we have someone over there at the bedside working with the patient, working with the case manager for that seamless transition into the care that they need.
And it shows. When I was at the hospital, the respect was there, so it was really cool. What are some of the most common misconceptions families have about senior living communities today?
I think it's still that they think that residents just come here to pass, or
I believe you're right. Because
that's always been the thing.
I hear that even from going to church. I have a lot of church members that'll ask me questions about what I do, because I do talks there as well. And afterwards, I'll take the questions, and that's a big one right there. People really do say that, which sometimes helps home care for me. They want to stay at home as long as they can, but some of them feel like they want to stay at home because of that.
Stigma.
Like, it's not that. So
when you come here, I mean, we have residents that have been here for over 10 years.
Yeah, that's crazy.
And they are thriving because they're getting, the ADL care that they need. They're getting their meals, maybe sometimes they're getting companionship.
Right.
As you get older, your friends kind of are living their lives.
Yeah.
Say
the ones in the 80s.
Yes, absolutely.
Have lost a lot of their family and friends at this point.
And they need that socialization. And the activity director here does a wonderful job. You have music, you have art, you have crafts, different things to try to keep them busy. And then just the community of dining. I hate seeing people dining alone. When I go to a restaurant and I see someone dining alone, it makes me so sad. So it is nice to see the four, residents sitting at a table, they're conversating, they're having a good time. Or, if they have that situation where they want to eat in their room, they are more than, welcome to do that.
Flexible.
But they have the flexibility and not just being at home and having that isolation.
Let's just say Pinellas County, we'll draw it in a little bit. Anything where the senior population is growing quickly, which it is here, what trends are you seeing in senior care and housing? Are you seeing anything that's standing out at all?
I think inpatient rehab.
Yep.
From when I started, you might see one or two inpatient rehab. The criteria has changed a lot. Just like with skilled nursing is not what it used to be 20 years ago. We're taking a lot more complex. So it's almost like you have the hospital, you have the LTAC, you have the inpatient rehab, you have the skilled nursing, assisted living, you have the private duty, you have the skilled home care, you have all these facets of options to you. Depending on where you're at in life. And I think that the biggest one that has grown over time is the inpatient rehab. I mean, I feel like now we have them on every corner.
Yeah, I do too. That and the emergency room. So the minute clinics, whatever people want to call them, I don't know, but they are popping up everywhere. And I feel like that's since COVID. I think post-COVID or pre-COVID, I didn't see as many of the walk-in clinic style emergency clinics.
Right.
You know?
I seen on the Business Journal that it was due to the baby boomer generation and trying to gear up for that because it's going to be crazy. And I think that I would rather us be prepared with empty ERs than to be overloaded with ERs and not have enough staff to care for the patients.
I agree.
Or those long wait times.
There was actually a new one that just popped up in Countryside. I was watching that one being built and I was like, oh my gosh, I feel like there is one right down the street, walkable on the right-hand side, on the other side of the street.
Yeah, I think there's probably 3 or 4 within like a 5-mile radius of ER.
So if you need an emergency room, you could pretty much walk to any one of them you want in Florida. So come on down.
And no wait.
Yeah, there's so many of them. How important is social engagement and community life for seniors? And then what kind of programs or activities make the biggest difference that you see in a resident? And that may vary depending on what they can do. But
I was introduced probably 10 years ago to music and memory.
I love it.
There was grants that were being distributed in Ohio they were iPods and they would program the music to whatever generation, from any, rock and roll to the symphony. And I seen a lot of progress with that when it came to the dementia residents.
Yep.
But I will say, going into the baby boomer generation is kind of the after hours.
Yeah.
The wine Fridays and the outings, going out to restaurants, getting your bus, filled up to go on a shopping trip. I think that those are important just to maintain that independence. But if I had to pick like my favorite, it would be the music and memory.
One. Yeah. I actually was at a rehab, newer one that opened up, and they had a girl in there with a guitar, and that was what her profession was. And I was like, it's something that I'm gonna have to put her on a podcast at some point and find out who she was. But it's something you don't think about until you meet someone that does it. And then they talk about it and you're like, it makes such an impact. And then there's also things that I learned by talking to her that you may have a person that goes into a hospital and plays the guitar in front of someone, and they're just a random person that goes in and does that. But the training, and she told me like there's so much training involved in that person may be wanting to do a good thing, but they may be triggering something at the bed next door or something like that. So there's an art to and a science to what they do with the music. And I think that's incredible. What a cool little niche to be into.
Yeah, if you see the music, there's places, Shepherd's has music every night, a performer every night.
Yep.
Well, those performers are going to age.
Right.
That doesn't mean that they get tired of hearing the music or playing the music. And I think that being able to, I walked in on Friday at our building at the Palms, and they're playing music and people are dancing. Nobody's really upset when there's music playing.
I agree.
I think it eases tension. Absolutely.
Yeah.
So.
It is. It feeds the soul. Feeds my soul. So many families struggle navigating the healthcare system after a hospital stay. How do senior living communities help bridge that transition and prevent rehospitalization? Because that's a big thing for all of us in the industry, including home care. That's something that I actually will go into a hospital, and we don't go into hospitals all the time.
Yeah.
But that's the one thing we do go in and talk about, because home care could play such a huge role in a readmission. how does a facility handle that as well? And I think it's huge for you guys.
Early on, you have to catch it early on. So from the moment that we get the referral, we work on discharge planning, even if that means the patient's going to be staying long term.
Yeah.
That's still considered a plan of, when we look at it, what is their discharge disposition? Are they going home to an ALF? Are they going home to a second story apartment? All of those factors we have to play into. And it's like, what was their level of independence before?
Right.
And what is it? It's the realistic level now. And then we can always try to work to get them as close as to where they were when they started, but sometimes that's not feasible.
Yeah.
And that's where we look at, okay, do they need skilled therapy, home care 2 to 3 times a week, but they also are going to need long-term private duty to maybe help them with a shower once a week, or help them with groceries, or whatever the case may be, taking them to appointments. We might need to schedule transport. So we kind of develop a discharge care plan that adheres to, okay, this is the goal. Sometimes it's a long discharge plan, right?
Right.
So they come in, they're under Medicare, they get their therapy. Realistically, they're not going to be able to go home to that second story apartment, but they would be sufficient in an assisted living. So we're going to work them into the assisted living. Next step is, what is their financial, commitment? What are they able to pay? And does that determine whether or not we need to apply for Medicaid? We start applying right away, get them on the waiver, and then sort of transition them to that ALF, take them to ALFs to tour, utilize our partnerships that we have, with other providers. And then the same thing with private duty. We have a lot of contenders where they don't know that you guys are out there sometimes.
Right.
And I think just having people coming in and talking to them and kind of sharing what the options are available to them.
We still get calls all the time about, we need you. We're home health care.
Mm-hmm.
I need home health care. What insurances do you take? And I'm like, no, that's not what we do.
Mm-hmm.
I will help you and guide you to find a home health care company that's good and I can put you with, but that is not what we do. So,
but then 30 to 60, then they're out. Then what do they do?
Yeah,
that's
exactly.
when they need to call on you guys to have that continuous help.
I try and follow those ones that come through. Yes, I'm going to help you, but I know you're going to need me at the end. So it's such a crazy, vicious cycle. And to all the listeners, I hope you really heard and understand what she was talking about with that long care plan and all the steps that go through. Because if you look at every building, let's say these buildings have hundreds of beds and hundreds of people in them, every single person that's in there is a person that they go through that whole spiel with. So it's not easy. And some of the stuff takes time and it takes a lot of care. So you have to really want to love your job and do your job well in order to do that amount of people on a daily basis. And so you're not just shoving people in and getting them out beds and heads or heads and beds, whatever they call it. It really is a lot of work. And there's so many residents that come through. It takes a team. It really does. It takes a whole team to go through all that, and a caring team.
I will say, it's Social Work Month, Social Work Appreciation. They deserve it all.
They do.
Because they are navigating sometimes impossible situations that they have to work through for each one of our residents. And as you know, they're all different.
Yes.
So they all require a different level of compassion and just work.
Yeah.
So, kudos to them.
I agree.
All the things they do.
Happy Social Workers Month. Looking ahead, let's say 5 to 10 years, how do you see senior living evolving, especially with technology aging in place and the expectations of the next generation of seniors? What's that looking like? Technology is getting crazy.
Seeing AI.
That's right.
We have AI for a lot of things. I think it's going to help us not be, I want us to not be so much behind the computer and getting back to the basics. I remember early on in my senior living experiences, we did a lot more hands-on time. And I think we got away from that because, we have to follow our stipulations of ACA and things like that nature. So sometimes the care plans, I don't want us to just be putting a lot of information on paper and not have the time to produce it out there in the environment. So I'm hoping that the AI streamlines that so that it'll be more efficient so that we can give the time back to the residents that we serve.
I've seen things like little caregiving robots that roll around and give certain things, or if it's medication, it releases, or the DoorDash robot. Yeah. You've got all these things. I think that I would love to see that robot not do that, but to follow you around and be almost like a personal assistant that records everything and then puts it into spreadsheet or puts it into something.
I think you're onto something.
You don't have to do that. It follows a caseworker into the room and then records everything that's being said in the discharge plan.
Yeah.
And then that gets put away and then also given to the family member or whatever it is. And then, all of a sudden, you don't have to go back to the office, into your office and sit down behind the computer and do all that stuff. My idea and run with it.
I think that's a great idea, because you always see your doctors with their recorders, for dictation. And it would just be so nice to, as you're going on a day in the life of Holly, I can only imagine what they would be writing down of all the different places I go in a day and all the different conversations.
Wow. It's wild. Well, tell everybody a little bit about where they can find you, email, phone number, what facilities that you roam at, maybe, and anything else you may want to talk about. Throw it in.
So with Aviata Health Group and the over 50 facilities, I cover 19, covering Hillsborough County. Yes.
Crazy.
County, Pinellas County, Citrus County, Hernando. I also cover a couple of facilities in Orlando and Lake Mary, but I am reachable by phone, by LinkedIn. My phone number is 937-716-5060. Still have an Ohio number.
Okay.
You can email me at hray@aviatahg.com. I am always looking to grow my marketing team. So if you are interested in a career with us, please let me know and I will get you over to our recruiters. But I thank you for the time that you spent today.
Thank you. It was
and
awesome.
if anyone has any questions, please reach out to me.
Yeah. Thank you so much. I appreciate it. Guys, anytime you need anything, give her a call. And once again, like, share, subscribe, all those things. Make sure you spread the word for the Chad the Home Care Guy podcast. I am on all of the different platforms, TikTok, Spotify, YouTube, Instagram, but I'm everywhere. So just spread the word, because that's what I'm trying to do by doing these, is actually spread the word and spread the education that maybe someone doesn't have a chance to get out there and introduce themselves to you. They're not a marketer. They're not someone that leaves the office. Hopefully that you come across this podcast and family members as well. And that's what I'm trying to do by doing this, is just educate everybody on the healthcare scene and what we do on a day-to-day basis and give you guys some tips. All right. Well, until next time, I'm Chad the Home Care Guy, and I appreciate you guys watching, and I will see you next week. Take care.